So when you're ready, take it away.
Thanks, Chris. So, and thank you again to yourself and for Penprint for inviting me to give an update about our research project. So I think the last time we spoke, we gave a bit of an overview. We talked a little bit about anxiety and Parkinson's and a little bit about our current research project. So I thought it'd be helpful to start off with a little bit of an update about what we've been doing since then. So since we last spoke, we've completed several projects. The first big one was using something called group concept mapping, which is an online, study where we essentially asked people with Parkinson's, carers and occupational therapists to take part in a online consensus process where they gave the information, they gave their thoughts and ideas about what should be included in a new intervention to help people with Parkinson's to live well with anxiety. And then we went through a sort of a structured process within this secure app to generate a map of the different concepts that people felt should be included in a new intervention. So we closed that study a little bit earlier this year. We recruited over 80 participants who took part. The majority of the people that took part were people with Parkinson's, which is really, for me, really important to have that involvement of people living with the condition in developing the new intervention. And we had less carers and less clinicians taking part, which is a shame, but we managed to get some involvement and the voices of those people heard as much as we could. I think there's probably some reasons, looking back at the research and what we can take forward, of why perhaps those two groups of people, carers and occupational therapists, we perhaps didn't get as much as a response from those groups of people. So firstly, clinicians, I think we're all very well aware of the strain that the National Health Service and social care services are under at the moment, and particularly with COVID-19 related burnout coming out the other side of the pandemic. I think that likely had an impact on our recruitment rate for occupational therapists. And removing the barriers to research engagement for carers is a real challenge. Often carers have multiple roles, they have multiple expectations and demands on their time. And whilst we set the research up to remove as many barriers as possible for people, it's likely that some of those barriers remain. So something that we're going to need to think about for the future is how can we further improve and make it easier for care partners and occupational therapists in particular to take part in our research. What can we do more as researchers to actively reach out and help those people get involved? What we found from this study is we ended up with something called a concept map, which is a visual map, a really nice visual map with the different concepts that the team, when I say the team, I mean all the research participants, contributed. Essentially what we came up with were 8 different concepts that are going to go forward to be we're going to go forward to be included in developing the new intervention. These included things such as helping people to manage their conditions more effectively from a lifestyle perspective, looking at increasing people's physical activity to manage their condition, improving access to up-to-date information and education, and also how can people establish more effective supportive relationships with other people. So those were just some of the concepts that were included. What we then did in our next study is we took those findings and the findings of our previous research studies and PPI consultations, the previous studies being something called a scoping review, which is a type of systematic review, and a piece of qualitative research that we completed a few years ago and was published in 2021. We took all of that information from all those different studies, combined them into a plain English information pack, and then we recruited, our sample size for the next study was 30, and we recruited 32 people, including people with Parkinson's, carers and occupational therapists, to take part in a process called logic modelling. And logic modelling is an approach that you use to essentially map out a process of how something should happen. And in this instance, we wanted to use logic modelling to map out how the new intervention should be delivered, how people felt it should be delivered, in what order things should be delivered, and what outcomes were particularly important to people in the short, medium, and long term. So we gave the participants this information pack. I answered any questions that they might have. And then I ran a number of different focus groups and one-to-one sessions where required, if people couldn't make a group session. And we worked together, we sort of collaborated on populating this logic model in an order that the participants felt was meaningful to them and made sense to them for how the intervention should look and be delivered. So what the outcome of this, after we went through a further data analysis process as a research team, what that essentially gave us was the meat on the bones of how the new intervention should look like, and what sort of process you'd have to follow for delivering it, what sort of resources you would need, and also what sort of outcomes we should be aiming for. I've now just been in a process of actually building the new intervention, which is very exciting. I've been working on this research question and topic since 2015. So now to be at a point where we're actually able to pull together a robustly co-produced intervention is really exciting. The acronym or the abbreviation for the intervention is OBtAIN-PD. And how OBtAIN-PD is going to sort of be delivered as a package compared to other interventions for people with Parkinson's living with anxiety is, firstly, it's going to be focused on doing. So it's going to be focused on what we call meaningful occupation and doing. So it's going to be, rather than a talking therapy where people sit and talk about their feelings, and there's certainly value to those sorts of interventions, people with Parkinson's and carers have told us that a new intervention, they didn't want another talking therapy. They wanted something focused on doing and actively addressing the challenges that they were finding. So that's going to be the core concept of the intervention, a focus on doing and a focus on actively looking at the problems that people are having and removing any barriers to participation that they might face. Alongside that, it's going to be underpinned by some different theoretical concepts and approaches. So first of all is something called lifestyle redesign. This is an approach that came out of a big study called the Well Elderly study from the University of Southern California quite a few years ago. And that was a really seminal research study in occupational therapy. And essentially lifestyle redesign almost does what it says on the tin. It looks at the different components of a person's lifestyle and how do you modify and help somebody manage those aspects of their life to live as well as they can with a long-term condition. So we're taking some concepts from that approach that people have identified are really, really important, and we've developed some information and support to target some specific areas that have been identified in our previous research studies as particularly important to people with Parkinson's. It's also going to be underpinned by some psychological theory and concepts from an approach called acceptance and commitment therapy. And the idea behind that was from the people that participated in our studies, that they felt the idea of accepting and living with a complex long-term neurological condition was really important to help people move on and progress and almost reclaim aspects of their lives. So we've taken some elements of that to kind of theoretically underpin this intervention and how it's going to be delivered. And finally, an approach that we're sort of dipping into and taking aspects from as part of the intervention package is something called motivational interviewing. So motivational interviewing is a technique where somebody almost coaches a person through solving their own problems or coming up with solutions to their own issues rather than being told what to do. And the evidence for motivational interviewing is that it often leads to improved engagement and adherence and sort of better outcomes for the person that's being supported. So that's roughly what the intervention is going to look like. We're going through some final refinements at the moment. It's going to be what's called a standardized intervention. What that means is that a treating clinician or an occupational therapist in a community rehab team can pick up the book, read, go through it, and then deliver the intervention to the person that they're working with. We've designed the intervention or co-designed the intervention with occupational therapy colleagues and based on the feedback from people with Parkinson's and care partners, so that it can be delivered by an occupational therapist who doesn't have a speciality of working with Parkinson's. It's recognised that there aren't many Parkinson's specialist occupational therapists in the country, so it was really important to our participants that the package could be picked up and delivered by somebody who didn't have specialty knowledge. So there's that element. It also means that people can pick up the intervention and reproduce it time and time and again in the same way. This might be really important if somebody gets re-referred back into a service at a later point in time. And it's also really, really important from a service perspective so that you can check and compare that what you're doing is effective and is making and helping to encourage improvement over time. So that's where we're up to at the moment. The next step that we're planning for, now we're moving towards refining the intervention coming up with our package, is setting up something called a setting up something called a feasibility cluster randomized controlled trial. We're planning to start that in January 2023. We're going to hopefully start recruitment across 2 sites in the Southwest Peninsula. The idea of a feasibility trial or a feasibility study is to, one, test that a bigger trial of the intervention to test its clinical and cost effectiveness is going to work, it's going to be feasible, it's going to check that it can work in a busy NHS setting and be delivered, and also that we've designed all of the very complicated interlocking processes of a trial, that we've designed them in a way that will help us answer the research question and not actually give us almost like a false answer. It's also going to help us do some initial testing that the intervention it's realistic to deliver this intervention in a busy health and social care setting. So we're hoping to launch that study in January. We're aiming for a recruitment and intervention window of 10 to 12 months. So we're going to recruit people from January to the end of October next year. And then to account for the follow-up period that people will be going through, that will take us up to December. And then following that, I have a lot of analysis and writing up to do going into the end of my PhD. So that's our current research project we're up to at the moment and where we're planning to go to next.
Well, thank you very much indeed.